Now you have, I think, 10 abstracts, posters
Yeah.
in this session. So you're obviously a very, very busy man, and
Yeah.
you're really doing a lot of very good translational research
Yes.
and so on. But you were wanting to tell us a little bit about the head and neck work that you're
Yes.
doing here.
Yeah, this is, I think, is an outstanding trial because in this trial we address the question of quality control radiotherapy and its impact on outcome. And for the first time, we were able to prove that those patients were not properly treated according to the quality assurance. They have a reduction in survival, a 20% reduction in overall survival. So it's I think it's an important information we need to address, and we need to we share with all the people to know that.
So just tell me what you did. You showed that if the quality of the radiotherapy was not optimal, up to the proper standards, there was a 20% reduction in survival.
Yes, yes.
That's massive.
Yeah. In fact, we conduct an international trial for head and neck, addressing if a tirapassamine was an hypoxic radiosensitizer in combination with concurrent chemoradiotherapy may improve survival. So indeed, it was an international randomized trial. We recruit 850 patients in all over the world. And the trial was negative for survival, the main impact of the trial. But in this trial, the procedures of quality assurance on radiotherapy were very well established. Every patient included in the trial, investigators were required to submit all the documentation just in the first week of treatment to external review center. It was called QARC, Quality Assurance Radiotherapy, and they perform a rapid review to follow if the investigator has followed the guidelines of the protocol.
With fields and doses.
Field and doses. And those no compliant plans, QARC sent to the investigator that was not compliant, and they made some suggestion for corrections. So on the end of the treatment, members of the trial manager committee that were radiation oncologists, we went to QARC for the final evaluation. We performed blindly without knowing which patient was, and we found that 12% of the treatment plans there is a risk of reducing the tumor control probability because of lower doses on the tumor or plans in corrections. So we look at the survival according to these criteria, and we found that those patients were treated badly, incorrectly. The reduction in survival at 2 years was 20%.
Wow.
And was also very interesting, is an important data also, I think so, is that then we look at those patients treated properly according to the protocol. And in those patients treated according to the protocol, we compare those treated with tirapassamine and without. And interestingly, in the patients well treated, tirapassamine produced an additive effect and improve in local-regional control. The question, because of the number, is not significant. There is a clear trend. The p-value is 0.06, so really a good trend. Excellent local-regional control at 2 years, 80% in patients treated with radiotherapy and cisplatin, and 85% in patients treated with radiotherapy, cisplatin, and tirapassamine. So what we could show is that randomization was not a safeguard for treatment and correction. So in the future, all the trials addressing a question where radiotherapy is there needs to have a quality control procedure.
From the beginning?
Yeah, because if not, probably the conclusions of the trial will be disturbed by the effect of a poor quality radiotherapy.
That's very, very important, and I congratulate you on doing that.
Yeah.
You do a lot of clinical trials. You're also planning a trial, a big European trial on radiotherapy in children's
here in Barcelona, we are also presenting, in fact, Rolf Korman, who is a German investigator, we present the data of a SIOP for treatment of hyperfractionation radiotherapy in medulloblastoma. In Europe, we are all the pediatric radiation oncology and the pediatric medical oncology. We are working together because of the numbers. We need an international collaboration. So we include 350 patients, and we randomize the patient. Medulloblastoma is a brain tumor, and it's a tumor that can relapse in the whole CNS. So it needs to be treated with a craniospinal irradiation, and then we ask whether hyperfractionation, craniospinal irradiation may improve outcome and also may decrease toxicity.
Sure.
In this trial, the trial was negative for the primary endpoint, so the survival curves were the same for children treated with standard radiotherapy with hyperfractionation radiotherapy, but we proved that with hyperfractionation there is a reduction in toxicity, especially in ototoxicity, and also we found that in the intermediate risk group, the use of hyperfractionation may improve local regional control. The problem is because it's a subgroup analysis, the number is not enough to show differences, but there is a clear trend. And now, in the future trial, we are considering in these patients the use of investigate again the advantage of hyperfractionation radiotherapy in these patients.
You're a busy man.
Thank you.
Thank you very much indeed for seeing us.
Yeah, nice to meet you.
Thank you for having us in Barcelona. Thank you.